better, be healthy, and do the things we need to do and be aware of things so that God will keep us in perfect peace with our mind stayed on him. We are excited. We're just going to sing a little bit of this song. Bless the Lord, oh my soul, and all that is within me. Bless his holy name. He has done great things. He has done great things. He has done great things. Bless his holy name. Just want to say good morning to you on YouTube and Facebook this morning. We are thankful that you're joining us here at New Heart Christian Center. He has done great things. We want you to please share this morning. We have great information. He has done great things. He has done great things. Bless his holy name. Elder Dukes is coming at this time to lead us in prayer, and then Evangelist Dukes will come and introduce our speaker for this morning for our health and wellness session here at New Heart.
Bless the Lord, O my soul, and all that's within me. I will bless his holy name. Father, we thank you today for this day you have allowed us to see. We thank you for those that are watching online and those that are here. Lord, we just ask that you would just bless us today in this health and wellness seminar, God. We just ask that you just bless our clinician, oh God, and that, Lord, you just help us to receive all the information, Lord, that we need, Lord, for a better life. And Father, we just give you praise, we give you glory, and we give you honor. In Jesus' name, amen.
Good morning. Our presenter for today is Brother Nira Durden, who is a member here at New Heart Christian Center and is currently the Director of Nursing at Market Street, which is a memory care residence. Please receive Nira Durden. Thank you.
Good morning, good morning. First of all, I just want to thank the Lord that we're all here. We woke up in our right minds and our right spirits. And it's a blessing to be and to pray. Kind of took me aback a little just to kind of think of what it is that I could bring and share. Just a little bit about myself. I've been a nurse, a registered nurse, since 2006. And in that time, I've been in different areas of nursing. Everything from working in corrections to working at the Department of Health, and also I've worked in the ICU at Halifax Hospital. Everyone knows Halifax. And then recently, within the last year and a half, I've been the Director of Nursing for a memory care unit. I'm based out there in Palm Coast, and we take in residents who have diagnoses of dementia, Alzheimer's, Parkinson's, those things. And one of the grand things about that is I remember I had a family member, and she had gotten Alzheimer's. which is something that a lot of African American families are familiar with. But it's, how do you maintain these people? How do you keep them? A lot of people think that, small memory lapses are just a part of aging. And in our community, that's okay, you know. But there are signs that you need to see that will tell you that someone is progressing from these mild cognitive declines into progressions towards dementia. And those are, when you're seeing those signs, those are things that you really want to have a medical professional come in and try to give you interventions and things to help with that. And that's kind of what I'm going to talk about today, is the signs. As I said, a lot of people believe that it's occasional to forget things. I forgot where my keys are, or I forgot today that I had an appointment. Well, when this becomes a repetitive thing, when it becomes something that is consistent, then that's something that should be a red flag for you, that there's more going on than just natural aging and then just natural forgetfulness. So in that case, you can go towards what is dementia. Does anyone have any idea of what dementia actually is? So dementia is pretty much a catch-all phrase. It's a broad term for multiple symptomology and multiple things. There's various types of dementia, and basically you look at it as the reduction in mental capacity. It's the cause of functioning that interferes with your daily life. So you can have diminishing in your focus, attention, language skills, problem solving, even visual perceptions. Dementia can also make it difficult for a person to control his emotions, or even be led to having different personality changes. According to some 2023 figures from the Alzheimer's Association, it's estimated that there's 6.7 million Americans are living with Alzheimer's disease. And the most common type of dementia, that's the most common type of dementia, is Alzheimer's. So everyone, when they hear that someone is having these symptoms, they always think Alzheimer's. That is not the only type of dementia that someone can have. They can have, dementia is basically a spectrum. And when I say a spectrum, you can have people who have milder dementia, and they will have simple issues where they just need to be redirected. We have, in our facility, we have 68 residents, and you have people who are on that full spectrum. I have some individuals that are just like me, and I come to them every day, hi, and they remember who I am, but they just need small cues, like, you haven't gotten your shoes on today. You might want to go back to your room and put your shoes on. And they'll say, oh, okay, and they'll go and do that. But we have some that they will not be able to recognize from minute to minute what it is that they need to do, whether they need to be fed, whether they need to do grooming, wash your face, brush your teeth, toileting, different things of that nature. So what are some of those signs? It's someone is showing signs of dementia. It's important to see a medical professional who can conduct tests to come up with the diagnosis. There's many things that can mimic a diagnosis of dementia. Say someone has a urinary tract infection. Okay, if you have a urinary tract infection, you can become confused. You may be forgetful. You may be unable to recognize, people that you've known, but that's a regular infection. So whenever you see someone, and when we talk about these signs, the initial thing you want to do is to rule out anything that could be another medical issue, like a vitamin deficiency or a urinary tract infection or something of that nature that may be a simple fix. You may have someone who's having an addiction and they may be imbibing in a lot of alcohol, and that may have caused a change in their body chemistry, and so now they're having all of these signs. But if you treat them and you eliminate the alcohol, then that fog, that confusion will clear up, and so they won't have dementia. It was something outside of that. Okay? But my main thing today is to give you all, I'm going to talk about 10 early warning signs. Now, if you see these things, this does not necessarily mean that somebody has dementia, that they're going to progressively decline, and you're going to lose your loved one to Alzheimer's. But in seeing these signs and being aware of these things, you can notice that these are occurring events. I need to get someone tested. I need to have someone taken to my primary care doctor or have them tested to see what is going on with them, to see if this is something that they're progressing towards. And if they are, there's treatments and there's things to prolong their quality of life. Okay? So if you take anything away from this today, look at your loved ones, look at certain signs, certain things that are going on with them, and make sure that you are reaching out to your healthcare providers and being tested and being treated. Yes? So what I'm going to do is I'm going to give you the signs, and then I'm going to talk to you about a couple different tests. And I have one simple test I'm going to give you at the end. It's a mini mental exam. And it's just a myriad of questions that you can ask someone to see how they respond to these questions. And how they respond to the questions, it gives you a number. So out of, I believe it's like 20 questions. And out of those 20 questions, if someone is able to go through all of those questions and they're able to answer them all, then you'll see that, okay, they're functioning correctly mentally. If they miss a couple of those, then it may be a mild thing. So then you'll go towards, well, maybe we need to have some labs done to see if there's something else, as I mentioned, like a UTI or something of that nature. You want to have that done to eliminate that. And once I find out that it's none of those things, then we can look at the cognitive things. Okay? So 10 warning signs of dementia. Does anyone have any idea of a warning sign? Anything at all that you would think? Confusion, memory, losing things, right? What'd you say? Defiant. Yes. Combative and okay. Yeah. Very good. So, number one would be difficulty with everyday tasks. So everybody makes mistakes, you know. Sometimes we have things that we forgot to pay the water bill. I know the pastor would never forget to pay the water bill because Sister Buzz wouldn't allow him to. But those things happen. You know, I was supposed to pay this bill on the 12th. It's now the 15th. I forgot. Those are everyday things. But when you have increasing difficulty in doing things, such as like you have a family recipe that you've done for years. And now I can't remember how that goes. Now, I know my mother, she doesn't write down recipes. She just, it's like I'm in the kitchen. I'm like, Mom, tell me how to, well, it's a pinch of this or a dash of that. And so those things, and because those things have been passed down, so you remember all of those. But when you have increasingly difficulty trying to remember those things, that may be an early sign. You may find it hard to concentrate on tasks, or it may take you much longer to troubleshoot something. So when you see increasing difficulty of everyday tasks, something that you do every day, and now you're having problems remembering how to do that. So like I was telling Camille, raise your hand. Yeah, I'm gonna put you on blast. So we were in the kitchen, and I have like this beef stew that I cook. I think it's one of my major things that she doesn't like to cook. She always tells me to cook. And I think I do pretty well with some things. So my beef stew is like one of the things that she loves, and I make it well. But I'm in there and I'm trying to remember, what did I put in it? Because now I know that she likes it so much. I want to make sure every time I make it, it's at the same standard that it was before. So I'm sitting there and I'm like, oh, what did I put in this the last time that she liked so much? That's an everyday thing. It's something that I've done multiple times. I always do. But for that moment, and it was like, oh, I remember. That's not a sign. It's something that is on a consistent basis if you're seeing that you're forgetting. So that's number one. And you don't have to write all of these things down. They're easy to look up. We're in the computer age now where you can Google some things. It's just having a sense of, let me find the basics. And then when I see the basics, I know that I need to have more care done. I need to seek more information, okay? So second thing, repetition. Asking someone a question over and over, or telling the same stories about a recent event multiple times. Everybody's now thinking of somebody who's done that, right? And there's events in your life that you want to repeat. Yeah, you got all the wives pointing. Yeah, he does the same thing all the time. He talks about this all the time. He scored 5 touchdowns in the football game when he was in the 12th grade. Ladies, that's not dementia. That's just us being proud of ourselves. Okay? But if someone is continually asking the same question over and over, and it's a repetitive thing, that lets you know that they may not be remembering what it is that they asked you before. So they're searching for something. And the reason I bring this up is because 9 times out of 10, the person who will notice these signs are the person that's closest to you, someone who sees you every day, someone, that's at church that you talk to every week, and they see you progressively changes. Because if I don't see someone all the time, it may be they'll tell me something, oh, okay. And then it may be a month I see them again, and they're telling me the same story they told me a month ago, but I'm not aware of it because I haven't seen them in that time. But if your wife is telling you every day, you forgot to take out the trash, well, that's probably not good because they usually do that all the time. But if it's a repetitive thing, they're telling you same stories over and over, they're asking the same questions, that's another thing. So you have the difficulty in everyday tasks, and then you have the repetition of certain questions. Another thing is communication problems. So if you observe a loved one who is having trouble joining in on conversations or following along with them, or stops abruptly in the middle of a thought, or is struggling to think of words or names or objects, that may be something also. You know, something that they come to you and you're discussing something, and then in the middle of the conversation they just stop, or they get stuck and can't remember what it is, so then they change to another subject. These are things just to be aware of. Fourth, getting lost. So people with dementia may have difficulty with visual or spatial abilities, and that can manifest itself in problems like getting lost while driving, or getting lost going to places that they've gone on a regular basis. Okay, and as I said, we're up to 4 now, but you're seeing these multiple things consistently. You know, you have times where people get lost going places that they go all the time, and then they'll call you up and ask you, how do I get to this place? And it's like, you've been there a million times. Let me tell you again. But if it's something consistent, it's just something you want to look into. Personality changes. As loved ones, we want to look for someone who's beginning to act unusually. And when I say unusually, you're looking for like an anxiousness, confusion, someone that's fearful or suspicious, or someone who becomes upset easily and seems depressed is something that you want to be concerned about. You know, we all have multiple mood changes. Things happen in your life. But if this is something on a consistent basis, and that's the key for a lot of these things, it's something that's repetitive and consistent. If you have someone that is anxious a lot, or they're suspicious, this may be another sign. Confusions about time and place. If someone forgets where they are, or can't remember how they got there, that may be a red flag. And as I said, looking at these things, that just should be something where you're like, we need to investigate a little further. Let's see, where are we at? 6. But I remember real quick. That's okay. We're going to take this little test at the end, and then we're going to figure out if it. So, misplacing things. Someone with dementia may put things in an unusual place and may have difficulty retracing their steps to find missing items. I remember, and it was, my grandmother was the person who had Alzheimer's, whom moved into my home, and we were taking care of her because at that time it was like, well, you're in the medical field and, you know, all of those things. And the sign that kind of caught everyone is that she would always be looking for her keys. Couldn't find my car keys, right? And one time we found the car keys in the refrigerator. She had gone to the refrigerator to get whatever, put the keys in there, and then didn't know where it was. Now, my aunt thought it was really funny. Mom, you got your keys in the refrigerator, and, you know, you need to get your mind right. You're just forgetting everything. But for me, it just seemed kind of odd, you know, because we misplace things all the time. If I lose my car keys, I might find them in the couch, or I put them in a place that I don't normally put them, but I never will put them in the refrigerator. So when I heard that, it kind of seemed, okay, what else is going on? So misplacing things. You have troubling behaviors. If you have a family member that has increasingly poor judgment, say like poor judgment with handling their monies, or even as simple as like grooming, you know, they forgetting to brush their teeth, wash their face, you know, routine things that we do on a daily basis. That may be something that needs to be looking into, because that's a behavior that might be a little troubling, because if someone's not showering, that should be a sign to you. You know. Number 9 would be a loss in interest or apathy for like social gatherings. You know, we talk about all the time. If you see someone in the church and you haven't seen them, we want to check up on people. Want to find out, you know, why aren't you coming to the house? You know, we want to all gather together. And sometimes you'll have individuals who aren't sick, they just don't want to socialize, or they are in a depressive mood, and all of these things, you know, there's various mental health issues that it could be, but it could also be a sign of progressing dementia when you're pulling away from the things that used to interest you, the things that brought you joy, the things that you wanted to do, and now you're no longer doing those things. You know, visiting families or different events that you would normally go to. So you start with a mild cognitive impairment, and that's just a jargon term. Mild cognitive impairment is like a very early sign. And those things, like I had mentioned, you might have diseases that can have you have those cognitive issues. But if you've ruled out all of that, those small things could be the beginning of a progressiveness towards a dementia diagnosis. And number 10, we have forgetting old memories. Memory loss that becomes more persistent and is often one of the first signs of dementia. So with progressive dementia, what happens is people normally they will have a far greater memory of things from the past than they do on the daily. Okay? So I can remember my childhood, but I can't remember what you told me 10 minutes ago. So but initially, if you see someone who's having trouble remembering older events from their younger days, memories that they've stored up, that's an initial sign, okay, that something may be impaired. Because as the disease progresses and you get further along, then you'll have that short-term memory that kind of diminishes, and then you'll have individuals who rely solely on. That's why, you know, they'll be looking for family members who've passed years back, but they don't remember that that person has passed, and that will cause them anxiety, because I've had residents who are in their 90s and they're looking for their mother, and it's like, I have to get home because I got to get home to start cleaning the house before my mom gets home. And this young lady, she was like 95, so her mother had been long gone, but on a daily basis, that was her behavior, is she's wandering all over because she's looking to get home because she needs to get to her mother. So everyone kind of, I know I gave you a lot of things there, but those are some signs. And what I can give, if they want to put it on the Facebook, is a link to how to recognize early signs. Okay? Yes, ma'am. Mm-hmm. Right. So there's different types of dementia. And as you mentioned, you have Alzheimer's, you have what they call vascular dementia, Lewy body dementia, and then they have like a frontal temporal. But what happens is you have changes in the brain chemistry. So there's a there is a disconnect. Like I can go into a restaurant and I smell the food, and so my brain connects with those smells and it tells me, you know, I'm hungry at this time. So when you have the, especially with Alzheimer's, because there is really no way to diagnose Alzheimer's except after death. We go by the symptoms that someone has to, because the only way to truly tell if somebody has Alzheimer's is to do an autopsy of the brain and be able to see where the changes in the plaques in the brain. That's how they can tell that it was Alzheimer's. But in seeing your physicians, they go by all of these symptoms and all of these behaviors that, we've learned over the years, and it's like that's where they'll make a differential diagnosis that this is what it is. So to answer your question is, because you're having those changes in the brain, your brain is not telling your body that you want to eat. So a lot of times, and you'll have people come, they'll want to give that person more and more food. It's like, you're losing weight, you're not eating. Here, take this. You need to eat. You need to eat. But their brain is really not telling them that they need to eat. So you can give them a 5-course meal, and they may take a little bit just to appease you, but then they're off to something else because their brain is not telling their body that you need to eat. And that is a progressive thing. And that's one of the things when you get to the latter stages of Alzheimer's is where people stop eating. One thing, there's a lot of interventions that you can do. One thing is we're kind of conditioned, especially as Americans, to eat 3 meals a day. So you sit down and you eat a big meal, right? What I try to do with some of our residents who don't want to do that is you give them small meals throughout the day, multiple meals. Instead of sitting down and saying, here's your breakfast, let's eat breakfast, it's time to eat breakfast, I'm giving you a little bit, so you're trying to keep up their carbohydrates and protein intake throughout the day. You're giving them multiple little meals. And sometimes it comes down to, and this is where you have to kind of understand once you know exactly what the disease is and you know what the process is, you have to kind of understand about quality of life as opposed to quantity of life. Because we all want everyone to live forever, which is not going to happen. So then you get to a point where it's like, I want you to have the quality. So if my loved one likes chicken soup, right? And that's what they loved, and I give them the chicken soup and they'll eat that, then I may give them chicken soup every day, all day, to make sure that they're getting something. Yes, as a healthy person, your thing is, I want them to eat a square meal. You need more than just this. But you want them to nourish themselves and you want to give them a quality. I have some people that, try to put other things in there, but they like ice cream and won't eat anything else but this. So you try to, and there's, different meals. You can get protein shakes. You can get different specialty meals for them. But the thing is trying to get something into them, and especially if they're at the point where they're needing their medication and needing their nourishment. Mm-hmm. 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 Right. That's you're okay with that. You're okay with that. As I said, if it's not if it's not a continual thing, where you're seeing that, because we all have that anxiousness sometimes. We all have you have 9 million things that you want to do, and your mind is because I'm
That's me. I have a time limit on a lot of things I be
right.
doing, and I'm trying to do this and don't forget that. And then while I do it, I'm on
Right.
95 and
Right.
well, my mind is racing. I know.
So I'm gonna give you guys just a few percentage things, and give you a helpline. Like I said, if you're seeing these signs, there's always ways to get more information, places that you can reach out to. And then I want to tell you a little bit about my facility, and then I'm gonna give you a couple of these mini mental questions that you can think about. Okay? Yes. Hmm. No, honestly I haven't heard that one. Um, what I can say is that we we do breathe in a lot of different toxins, bacterium, virus, all of that stuff. We just went through a pandemic where we were breathing in a lot of infectious things. What happens is the hairs that you have in your nose are what captures all of those um, negative things that come in. If you're constantly removing all of that, you will just make it more receptive to you getting more infectious materials. I can't definitively say that you picking in your nose would cause you to have a brain infection, which would cause the chemistry to change in your brain, causing dementia. Well, it's very difficult to go from just the nasal cavity towards the brain with just your fingers. So that's why I say you can breathe in a lot of toxins and things like that, which breathing those in, they get into the lung, they get into your bloodstream. Into your bloodstream is what takes the blood up to your brain, which can change the brain chemistry. So it's just a matter of being hygienic, but as I said, and that's something maybe I need to look into, but I have not heard anything as far as that being the seminal cause of dementia. Right. Yeah. Right. It can lead to a multitude of things is what I'm saying is, and you're right. Dirty hands. You all, as I said, you're breathing in all of these things all day, so you already have negative things that you're breathing in. If you're introducing more, that can get into your lungs, into your bloodstream, and you can have a lot of different things that can occur from that. As far as that being something that causes dementia, I can't say that I've heard that specifically. So among African Americans ages 70 and older, they throughout it's about 21.3% are living with Alzheimer's dementia. So that's a lot, um, and that's for ages 70 and older. Yes. It's assistive in with as I stated before with Alzheimer's. There's changes in the brain chemistry. There's those plaques that come. So as we age, and you see it from a 2-year-old, you look at a 2-year-old as compared to a 10-year-old. The experiences and the things that they do changes the connections and things in the brain. So all of the reading and you continue to get those changes. It's assistive in decreasing some of that. As far as African Americans, we're twice as likely as whites to have dementia, and there's a lot of different socioeconomic. There's a lot of different financial reasons and all of that where it shows these disparities between our community and the general community at large. My thing as a healthcare professional is everyone make sure that you are getting checked, that you're going to your doctors regularly, that you're having your physicals. What you want to do if you look at the CDC will give you all the disparities between different ethnicities. And a lot of them, it shows that at the top, African Americans are high for all of these things. We're more likely to this, we're more likely to that, and a lot of that is because it's been ingrained a lot of times in us is that we'll do a home remedy, or I don't want to go to the doctor. And don't get me wrong, there's a lot of reasons, there's a lot of history behind why we don't, and why people don't trust the medical field. And also, and we've heard the bishop say it a million times, you want to pray, but you also want to have works with that faith. Yes, I know that my God can heal anything, but I also want to have direction from the Lord, and I also want to go to my doctor, whom he has also put in there as a professional to assist me along with that. So there's a lot into that always has us high in these disparities. So that's why myself, a lot of times, it's just the simple things. If you're noticing these things, let's stop, think about that, and then try to get the information, try to get the help, because you may find something early that may be able to be treated and lengthen your life. So it's about the information. 55% of Black Americans think that significant loss of cognitive abilities or memory is a natural part of aging rather than a disease. And it's like I said in the beginning, we all believe that as we age, it's going to be harder to remember things, okay? And that's somewhat true. But when you see it's something that is a continual progression, that is repetitive, then think, maybe I need to get checked about this, and it's not just that I'm getting old. And Camille can tell you, I say this all the time, I'm getting old. And I blame it on, she'll say, like, if I jump out of the bed and I got a pain in my back, she's like, oh, you're getting old, huh? So those things. But that's true. But if I jump out of the bed and I see something shoot down my leg, then I might need to go see the doctor, because that's not just a part of me getting old. So you have to be aware of those things. Um, last two things. The helpline, and this is from the Alzheimer's Association. And there's a phone number that you can call if you have, you're seeing some of these signs, you think somebody may be. You can call this helpline, and they will give you direction to places where you can be screened and get more information. Okay? Final thing I want to do, if there's no more questions, everybody's okay? Yes. Yeah. Well, it's twofold, honestly. One thing you find with older people, and more time than not, it's Alzheimer's is in the elderly population. It's a loss of independence, right? Exactly. So I want to be independent. I want to take care of myself. I want to do these things. But also the things that we know about Alzheimer's and dementia is we don't know exactly what that person is trying to get to or what they're thinking about. As I mentioned before, we had residents who want to go home because they need to see their mother, and they remember going home means I need to go down this highway. I need to go, and the only way that I can get there is if where's my car? You're trying to keep me here. I need to leave. So it's that independence thing, but it's also them having those memories of where they need to be. What they're thinking that they need to do is completely different than what you're thinking that they need to do. It's like you're safe, you're at home, you have everything you need right here, and they're thinking, well, I need to be at work. So I need my keys so that I can leave. And it's like, no, you haven't worked in 20 years. But that is not what they're saying. So, you have those things. And that can be dangerous because if you don't have someone who is recognizing these symptoms, you have individuals who live alone. They still have their keys. And I'm sure you guys have seen on the news, there's been times where you have individuals who get in their car and they just take off. And, they may end up in another state, or they may end up doing harm to other people because they're not in the right mind to be driving, but nobody noticed those signs. Right. Right. It's very difficult. And the thing that I can say is if you care for someone to that extent, you are gonna be able to take on that I don't like what you're doing to me. But you have to do those things. If it's the smallest thing, is that we just need you to get checked. Because it may be some of the other things I mentioned. It might not be that you're going towards dementia. You may have an infection. We just need you to be checked so that, And I have, throughout my nursing career, I've had people scream, kick, call me all these kind of things, don't want to do whatever. But I'm looking at it, and these have been family members too. You think you smarter than me. You don't know what you. It's like, okay, well, let's just try to check this out, because I knew they needed the help. So sometimes you kind of just have to take that bull by the horns, and it may be on a daily basis. What I teach to my staff is it's the approach sometimes. It's the approach that you come to. I'm not going to force you to do this. It's like, okay, grandma, we're going to visit such and such. Now, when we get there, this is not my friend's house. You tricked me, and I hate you. Okay, but I'm still got you here, and I'll take the hate because, well, I knew she was gonna forget anyway. But we have to do that. Sure. Heredity, yes, there's a component. There's a component for that. But there's a component also for heart disease. There's a component for cancer. So there's a component for that being something and that is another reason why, young people getting married, people coming together, you want to make sure you're getting checked. I want to know what's in your family history, right? Because if I know, I can love you better because this may be a reality for my life. I have here, this is a tool that I use. It's called a mini mental state exam, right? So I have, as I stated, I have a spectrum of residents. So I have some residents, I'm not supposed to be here. Why are you keeping me here, right? And I had one gentleman it was actually a thing when I came on, everybody would always say, he doesn't seem appropriate for here, something, and his history had been, he had alcohol abuse, all of these things. So he had a lot of those signs and symptoms that we talked about, but he never had physician diagnose him with dementia. They had cognitive declines, right? Which you can get from, as I explained, infections, alcoholism, a lot of different things. So it was like, okay, let me give you this exam and we'll just see where you are. Because if you're mild, then I can understand where you're feeling. If you're progressing, those things. So he took this test and he did better than me. So it was kind of like, because there's some, and I'll tell you one of the questions that was like, I'm sitting there like, oh, okay. So there's 11 questions here, and there's a total score of 30, right? So depending on where you score in here will tell me where you are. So there's a part on here that says, I would like you to count backwards from 100 by sevens. Stop after 5 answers, right? So everybody looking at me like that, right? So you all have dementia because y'all thinking, I can't count. I can't. So you start at 100 and you count back by 7, right? 100, 93. Look at you. So it's right, and it can be difficult. So, but it's the totality of the test. It's not just one question but this is a simple test that you can take that will give you a sense. Now, we're not all physicians. We're not neurologists. So what it does is we give this simple test. I get that score, and then that lets me know like a basis. Then I know I need to have other tests run, right? So if I'm seeing this and I see other symptoms, then it's like, well, possibly I need to get some lab work done because we want to see what, and if that's ruled out, then maybe you do need to see a neurologist who can do more extensive tests, x-rays and different things like that. So I'm going to tell you all of the questions on here. If you all want one of these tests, so you can take it home and you can, family night, you want to test everybody to see who has it and who isn't. Just get with me, I'll get you a copy. First question says, what year is it? What season? What date? What day of the week? What month? So, general question, right? If somebody gives you all of that, then they get 5 points for that, right? Second question, where are we now? What state, county, town, city, hospital, what floor? It's just awareness. So, yeah, I know we're in Florida, we're in Daytona, that kind of stuff. Like, who's the president? That orange guy. I don't know. Then, yeah, I'm gonna be in trouble for that one. It says, uh, examiner names 3 unrelated objects clearly and slowly, then asks the patient to name all 3 of them. So the patient response is used for the score. So then the examiner repeats them until patient learns all of them, if possible. So it's like I would give just like 3 general things, bird, pencil, car. Bird, pencil, car. Bird, pencil, car. And then you repeat those back to me, right? And then at the end of the test, I'm going to ask you, what were those 3 things that I asked you about? Right. So, as I said, this is not a definitive thing that says if you get all of these wrong, out of these 30, you scored a 2. You got it. No. It just lets me know that you're on my radar to where we need to do more stuff. So last thing, and this isn't to try to promote anything, but the facility that I'm at it's called Market Street of Palm Coast. It's a standalone memory care unit, and as I said, we have 64 like individual apartments, but we have 60. We can hold up to 68 residents. Sometimes in some of our apartments we have husband and wives, and everyone there has a diagnosis of dementia, Alzheimer's, Parkinson's. So we allow them to live the rest of their life there, and we care for them, but it's a locked unit. So you don't have the people who are wandering out into the community and being lost and all of that. And we provide everything from 24-hour nursing care to like physical therapy, psych services, everything that you need. And I am the director over all of the clinical side there. For to be in our community, there isn't necessarily an age limit. The youngest person that we have there right now is 56. The majority of our residents are older. I think the oldest resident we have there now, she just turned 101. But the thing you have to look at is that, and you do have where they have like early onset dementia or early onset Alzheimer's. So you have younger people who will get it. Like the resident that we have who's 56, she started showing signs in her 40s. So, but I have to look at, you don't want to bring in a lot of younger people with an older population, because younger people tend to want to do different things than, so you kind of have to make that balance. You understand what I'm talking about? So, yeah, there's not an age limit, but we do kind of take that into consideration when we admit someone. Yes.
There's a place that I go into Orange where they do research.
Mhm.
It's called Progressive Medical Research.
Yes.
And they do have studies that you can have Alzheimer's,
Mhm.
and they do blood pressure, and it's free of cost. And they start at the age of 60.
Yes.
You start doing it. So when you said the only way that you would be aware of somebody having dementia or Alzheimer's, they would have to do an autopsy after you pass. So there's the Progressive Medical Center with Dr. Muhammad.
Mhm.
They does studies down there in Port Orange, if anybody wants to know.
Right. So what I was saying as far as the diagnoses for Alzheimer's, the only way to diagnose Alzheimer's is after. With dementia, that's different because there's different types of dementia. Now, but when you go to the physician and they're telling you your loved one has Alzheimer's and they have that diagnosis on there, they're going off of all of the symptomology that they're seeing and just years of research. But to be able to say definitively that's what it is, because they'll give you a brain scan and they see the changes in this and that. But even looking at the radiology and seeing the changes in the brain, it's pretty much a guess, because I'm not looking directly at the brain. And the only way to look directly at the brain is to be able to cut it open and look at the plaques. So you're right. There's, they can do tests, they can do images and all of that and say, this is our definition of what's going on with you. But when it comes down to, that definitive, and you have people who, after they've passed, they've lived this life, they've passed, the family's not wanting to do an autopsy of the brain to say, yep, that was right. It's like, no, that's what they had. So, well, I thank you all for having me here. I appreciate you coming out.
I just want to ask one question. I wanted to save it till the end. Now, can you push the issue by doing too much and having too much on your mind?
As far as like a general, so for me, way I live life, everything in moderation. If you have too much, it's more of a physical drain and a mental drain, and you can cause yourself to have not just like these dementia signs, but you can have breakdown if you have too many things that are weighing on you. That's because we're human. Right. So to answer your question is yes.
Let's give him a hand. Wasn't that awesome? One of our own. Amen. Awesome. Want to say, Brother Nira, can you come if somebody want to get in touch with you or find out more? Can you give them your information that they can reach you? They might want to bring you to their church and do the same thing.
Sure. So I left a couple brochures over there that has my facility, but I also will leave some of my business cards with the church. And if anybody wants to reach out to me specifically for this, definitely.
They'll put it on social media.
Your facility offers like a daycare. To say me being a caregiver, if I wanted to go out for the day, would I be able to bring my loved one to your facility?
I guess the simplest thing to say is no. Because they're a private company, they do have day stays. So like I said, we have occupancy of 68. Now, if we're completely full, like I did an assessment the other day, so I have another resident that's probably going to come in next week, which makes us 100% full. But if we have an open apartment and someone comes in and they do an assessment and they want to have their loved one stay, we can do that. We don't do a lot of just like day stays unless somebody's trying to move into the community, because it's a big expense and it's a big liability to have someone that wants to just drop their loved one off and for us to take care of them until they come back. Because if something happens during that time, they're not our resident, they're just someone that's visiting. Yes, we have a full calendar. We put out a month calendar, and we do everything from, yes, we have the daily activities like exercise. We have bingo. They have this thing where they do appetizers and aprons, where we make certain little dishes and we have the residents cooking them. So we have all of that, but we also have on that monthly calendar where they take residents out to the museum and they take people out on little outings and all of that. So yeah, because the thing that we're not a nursing home, we're an assisted living facility. So although we're memory care, where people can only get in and out if we let you in and out, we're still an assisted living facility. So you want people to live their life the same way they would if they were in their home. Because that's how we want everyone to feel. This is your apartment. This is your home now. And you can have everything here that you would have at your home. But instead of you having to go out to the doctor, I bring the doctor to you.
Upscale.
You need to up my pay if you're listening.
And you heard that. Again, another hand for awesome. And we're going to be doing this more this year for our church on different topics, and for men and women, so we can stay healthy. And Janelle says she asked the Lord to let me live to be 130. So I told her I hope there's no storm or wind that day, because that would be, back to dust. Amen. But y'all will get that later. We want to thank all of you on Facebook and YouTube. And we hope that you enjoyed Brother Nira Durden, who did an awesome job. His father was one of our deacons here in our church, a great deacon. And we miss him dearly. But we thank God for his spirit and his son that comes and share with us. If you like to get that information, they have it, and we'll be having it up on our page. And we hope that you will tune in again with us. Stay tuned to all of our information. And on tomorrow morning, we have Sunday worship and Sunday school at 9 and morning worship at 10. And let's do it all over again. And remember, only what you do for Christ will. Amen. God bless you until we meet again.